Right. So we can describe the heart, then the blood vessels going outside the heart, then we go all the way down to the toe. Then we come back from heart, then we go to the head.
Mm-hmm.
So your heart has, I think, basic anatomy of the heart. There is two atria, two ventricles. The right side of the heart is receiving venous blood, and it receives the venous blood via two major veins. And those veins, we call them caval veins. Right? So there is a superior vena cava, then there is an inferior vena cava. Right?
Mm-hmm.
So superior vena cava, from its name, it would mean that it's draining blood from the upper body. Then inferior vena cava is draining blood from the lower body. Right? We'll join the veins after the arteries. So your deoxygenated blood goes into right atrium from the two cava veins. Then it goes into your right ventricle. Then the right ventricle will pump to the lungs for oxygenation. The vessel that carries blood to the lungs is this one in purple. Right. So normally, isn't we say veins, they carry deoxygenated blood. Then arteries, they carry oxygenated blood. But the only exception here are the two pulmonary vessels for the heart. This in purple here, we call it the pulmonary trunk. It will divide into a left and a right to go to the lung. So it divides into left pulmonary artery and right pulmonary artery. But these arteries are carrying deoxygenated blood towards the lung. Right. Then from the lung, we get pulmonary veins going back towards the heart. This time around, they go to the left side. They're carrying oxygenated blood. Right. So this is the only time where you find veins carrying blood with oxygen, then arteries carrying blood without oxygen, right? Then from your left atrium, you go into left ventricle. But this is an anterior view of the heart. If you're looking at the anterior view, you mainly see the right side of the heart. So right side of the heart is more anterior. Then if you go to a dorsal view, which is this one, you see mainly the left side of the heart here. Right. So from left atrium, you go into left ventricle. Then the blood goes into this vessel here, which is red, which is the aorta. Right. Confirm we did histology of circulatory system. Then you say they're muscular arteries, elastic, then you go to small, blah, blah, blah. Elastic arteries, for example, this aorta here, we call them conducting arteries. Why? Because they are the ones that conduct the blood away from the heart. So this is an example for an elastic artery. So your aorta, if you look at it, it has three parts. Which parts are they?
There's the left and right common coronary. Common.
No, those are branches.
Oh, you mean the three parts? There's the ascending, and then there's the descending, and then there's the middle part that then gives rise to the three branches.
The middle part, what do you call it?
Aortic arc.
It's the arcant. So first thing is ascending aorta. Does the ascending aorta give you any branches?
No.
Actually gives you the most.
That's where we get the vascularization of the heart.
Right. So that's where you get right coronary artery and left coronary artery. But they come from specific parts, right?
Okay.
So the reason why I said the right side of the heart is anterior, the left side of the heart is posterior, it helps us to know where the arteries are coming from. So ascending aorta, I can't find a picture that shows it, but it has 3 dilatations, which we call aortic sinuses. So there's a right anterior aortic sinus, there's a left posterior aortic sinus, and left anterior aortic sinus.
Is what? Left and right?
So for the right, there's only right anterior aortic sinus.
And then the third one?
Then left, there's left posterior and left anterior.
Okay.
Right. So if we're saying the right side of the heart is anterior, that means the right coronary artery should come from the right anterior aortic sinus. Then if you say the left side is posterior, that means left coronary artery should come from left posterior aortic sinus. Not sure if you then go with the branches now to say this branch goes this way, or you just want an overview, or you want me?
No, I want in detail, yes.
Okay. So if you look at the coronary arteries, I'm not so sure of your reference book, but under normal circumstances, you expect the right coronary artery to supply the right side of the heart, then the left coronary artery to supply the left side of the heart. Right? But these arteries, they end by anastomosing. Right? Their terminal branches will anastomose, but we call it a functional end anastomosis. Why? Because there's anatomic end arteries, there's functional end anastomosis.
This is new information. You're saying by anastomos, what do you mean?
An anastomosis, it's usually, I'll use an example at the elbow joint. There's an artery in the arm which branches going into the forearm. That's brachial giving region and ulnar. So imagine you're going to do this every day. Maybe you're a bodybuilder. When you flex the elbow, the blood will not flow to the forearm. So there have to be collateral pathways for blood to leave that brachial artery and join the arteries distal. So that if you do this, the collateral pathways provide circulation to the forearm. That's for the other things. Unlike the heart, though it's important, the arteries anastomose, yes. But if you block one, the other one will not help the other. So where you have an anastomosis, but if you block one, because if that wasn't the case, we would never have things like myocardial infarction or ischemic heart stroke, where if you block one, right? So if you block one, the other one will not help or compensate for the other one. Right. So you block right coronary artery.
I still don't get the meaning of anastomosis.
Okay, anastomosis is let me try annotate. I have an artery here, right? This artery is going to divide into 2 branches, this and this one, then maybe as well as this one, right? So what then happens is there are cases where maybe this is at the elbow joint, for example, here. I can block here. Maybe I've flexed in the gym, whatever. These arteries will have collateral branches that do this.
Okay.
So that in any case where I block here, where I put number 1 there, in any case where I block there, I expect to have a collateral circulation which gives or provides blood to the distal structures. Right? That's an anastomosis in general. The collateral circulation. But when you look at the heart, we're saying the heart has a right coronary and a left coronary. When I delve into the branches shortly, you see that it has more than 6 sets of branches, but those branches, they end by joining. So that's a form of anastomosis, but it's not going to help us if I block. This diagram that I showed, it's one way. If I'm going to block, there is collateral circulation to bypass the block. I think you've heard of people who quitting. You walk maybe 10 meters, then they get tired, then they stoop below. It's because then after they rest, they can continue their journey, then they rest again. Why? Because these collateral pathways, specifically going to the lower limbs, they are very tiny, such that they don't allow as much blood to pass through. They are small vessels. So zorora, that's when the oxygen will go. Then the muscles can now relax, then there is less lactic acid, then they walk again. But because ropa rukwenda ishoma already, they build up lactic acid, they get cramps over zorora. So it's a sign of vascular disease, claudication, which is when you walk, you get tired, you rest. It can be my blood vessels, basically top abdomen. When they are branching, you can block them. Right? But for this heart, I think, can you see this point here? Drawing part. This here is the right system. There is the, I think that's paper. That's paper and brown. I don't know. No. Number 1 kunoku, number 2 kunoku. Kuna 1 there is purple, kuna 2 there is brown. But can you see where they're almost going to join here?
Yes.
Then also here,
yes,
they're joining again there. So that's a form of anastomosis, but the anastomosis is not enough if I get blockage. So if you're going to block your right coronary artery, the left will not help.
Okay.
Though they're joining, yes, but it's never going to help. That's why we're calling them functional end arteries. Right. Then there's another term which is anatomic end artery. In anatomic end artery is one like this. This is my organ, the box there. This is the main branch of the artery in red. Then this in black is my artery going to the organ.
So, I'm sorry to disturb. You're saying, yes, the anastomos, meaning they sort of like join hands, but they are functional because the left coronary artery, maybe its function is to supply the left side. So if we block the right, even though it's joining with the left, it can't be helped with blood from the left.
But also, calling it a right doesn't mean it supplies the right only. You're going to see some branches that supply smaller parts of the left, then also from the left, they also supply smaller parts of the right.
Okay.
Then there's this diagram that I've drawn here. 1, 2, 3. So number 3 is the organ. Number 1 is a major blood vessel. Maybe, let's say, which branch can I give? Okay, any major blood vessel. Number 2 here, it's a branch going to the organ. This artery is a type of artery called an anatomic end artery. Anatomic end because it's just coming from its branch, then goes to the organ. There is no anastomosis there. So if I block, say here, I block here where I'm whatever shading, the organ will not receive any blood supply. So it's the organ will actually undergo necrosis and die because it's supplied by an anatomic end artery. That's one of the reasons why removal of the appendix it's really common, because the appendicular artery is an anatomic end artery. It doesn't anastomose with anything. If you block it, that's it.
Okay.
You now need to remove the organ, right?
Okay.
So back to our coronaries.
Mm-hmm.
So which one do you think is larger, the right or the left?
The left.
You've read that?
No, the left side is supposed to be like thicker than the right side because it's pumping blood to the whole body. So it needs more vascularity.
So your left coronary artery is larger. You've done anatomy of the heart?
Yes.
Good. So if you look at the atria, the upper part of the atria, there are these ear-looking auricles. Auricle is ear, right? Mm-hmm. So where you find the coronary arteries, right coronary artery is between pulmonary trunk and right auricle. Then left coronary is between pulmonary trunk and the left auricle.
Okay.
So I know you said left is larger, but it's also shorter. So this diagram that you're seeing here, or from the anterior surface of the heart, you don't see left coronary artery. You only see left coronary artery if you lift the left auricle. It's quite short. Then it immediately divides into two terminal branches. This one, which is called circumflex branch, then it also gives you this anterior interventricular artery. So if you have done that, remember between ventricles, there are interventricular grooves. Between atrium and ventricle, there are atrioventricular grooves. So the arteries that you find in those grooves, they'll just carry the names. So anterior interventricular artery, it's one of the terminal branches of left coronary artery. It terminates into circumflex artery and anterior interventricular artery.
Okay.
Yes.
Okay.
Right. Then right coronary artery, unlike left, can you see the right here? Oh, this is right coronary artery.
Yes.
Yeah, it's actually longer. It doesn't immediately divide. So along its course, it gives you branches, these ones here. So it gives you branches for the ventricle, we'll call them anterior ventricular branches. It'll give you posterior ventricular branches because there's part of the ventricle posterior as well. Right. But most importantly, right coronary artery gives us an artery that we call the right conus artery. Where does it go? You said you did that. So if you remember cone, like an ice cream cone, it looks cone shaped, and
yes, it goes
and when you did
apex.
It goes no, not the apex, no. And when you did the ventricles, you say the right ventricle continues as the infundibulum, which is funnel shaped.
Okay.
So from right ventricle, you go into pulmonary trunk, but first there's a funnel shaped infundibulum. That's where the right conus artery goes. For the left.
Sorry. You need to repeat that. We are saying the right coronary artery gives rise to the right conus branch, and it's a branch.
Yeah, it's a branch of the right coronary artery.
Can you point where it is?
This diagram is not showing that, but
just the area.
It will be somewhere here. Because this is the termination of the right ventricle going into this pulmonary trunk. So somewhere here, that's where the infundibulum will be inside. So most likely this branch coming here, but.
So can you please explain again the fundibulum?
Infundibulum, okay.
Infundibulum.
So if you look at the heart, the right ventricle. Let me see if there is. Right. This is the right ventricle. Right. From where you have this tricuspid valve going up. Right. This region higher up here, which leads into that purple vessel there. It's shaped like a funnel. So infundibulum simply means funnel shaped. So infundibulum is the tract that carries blood from the right ventricle into the pulmonary trunk. And we call it infundibulum because it's funnel shaped.
Okay. So the branch that is coming from the right coronary artery, that is called the conus branch. It's supplying it's a what?
Right conus.
Oh, it's a right conus. Yes. It's supplying the funnel-shaped area that is between the right ventricle leading to the pulmonary trunk. Okay.
Then from the left side, there also comes a left conus artery.
Okay.
Because we are calling this right, that means there's also a left. So if you use that concept for blood vessels, it becomes easy. If you call an artery anterior, there will be a posterior. If you call one right, there will be if you call one superior, there will be an inferior, right?
Inferior.
So the anterior interventricular artery, the one that we're saying is one of the terminal branches of your
left
coronary artery. It also gives us a left conus branch. So you can see it branches from here. So remember I was saying it doesn't mean if it's left, it doesn't give blood to the right. Right.
Okay. So the left conus artery, where does it go?
It also goes to that same infundibulum. So it's actually called a pulmonary conus. Infundibulum is just a way to describe its shape.
Okay.
Then other things that may be important to remember, there's something called the right dominance. You've done neuro?
No.
Okay. When you do neuro, there's also the dominance with which hemisphere controls the body mostly. Right. For the heart, for blood vessels, there is right dominance where I wouldn't know your text what they say, the percentage, but 90% of the population, the right coronary artery, when it reaches the base of the heart, it goes posterior here, is posterior interventricular artery. So right dominance simply means in 90% of the people, right coronary artery continues as posterior interventricular artery. And for left dominance, it's 10%, right? Okay. So 10% of the people, left coronary artery will give us posterior interventricular artery.
Okay. So we are saying we can get the posterior interventricular artery either from the left or the right. But for 90% of the population, it comes from the right and then 10% from the left. Okay, I got that. Okay.
Okay. Then you did conducting system of the heart.
Physiology.
Yeah. Even with the anatomy, there's SA node, AV node, the bundles, whatever.
Yes.
So conducting system of the heart is mostly on the right side, right?
Yes.
But doesn't mean all its blood supply comes from the right coronary artery. So most of the parts, the blood supply will come from the right coronary artery. Fair enough. SA node, however, SA node is the pacemaker, right? So most of the blood for the SA node is coming from the right coronary artery for most people. But for about 35%, this you also need to cross-check with your text. 35% they come from the left coronary artery.
Okay.
There is variation between people. Then remember your band of His divides into left bundle branch and right bundle branch. Right. So here's how I want you to remember. The larger one, which you said is the left heart.
Mm-hmm.
The larger one will supply both the bundle branches, right bundle branch, left bundle branch.
Okay.
Then the smaller one, which is right coronary artery, it only supplies the opposite one, which is left bundle branch.
Okay.
Maybe last thing I would also want you to know about this. So remember I was saying these arteries, the anastomos.
Yes.
So this anterior interventricular artery, which comes from left coronary, can you see it's going to the apex of the heart in this region?
Mm-hmm.
So in a certain population, it ends there. In another population, it will go down on the heart, on the inferior surface of the heart to join this posterior interventricular. So in 1/3 of the individuals, it ends at the apex. Then in 2/3, it will go all the way to the posterior surface of the heart.
So in 1/3 of the population, it just ends at the apex, but then
yeah.
Okay.
In 1/3, then in 2/3, it goes on the inferior aspect of the heart. Well, why didn't I use the word base?
Because that's not the base of the heart.
Right. So which one is the base?
The base is on the top.
Ah, great. What makes the base of the heart? First, I look for my branches.
Sorry?
What makes the base of the heart?
Isn't it the surface cinema auricles and the vessels?
Auricles, no. The auricles, you see them from the front. The base is somehow posterior. It's also your posterior surface, right?
Okay.
So it's mostly left atrium and the veins going into the left atrium, which are your pulmonary veins. Right.
Left atrium.
And pulmonary veins.
Pulmonary veins.
There's a very small part of the right atrium, but it's mostly left atrium.
And a very small part of?
Right atrium.
Okay.
So ascending aorta is only giving us the coronary arteries. Then from ascending aorta, we get, we then have the arc of the aorta, right?
Yes.
So arc, this diagram is not so correct, but arc starts here. What do you call this landmark?
Angle. It's an angle.
So you can call it sternal angle or angle of Louis, right?
Yeah. Yes.
So that's where the arc will start, and that's where the arc will end. So the arc starts at the sternal angle, arcs upward, leftwards, whatsoever, but it ends at the sternal angle again.
Okay. Yes.
So since you're doing all the vascular system, you're not doing thorax only. The arc gives you how many branches?
3.
Are you sure?
Yes, I'm sure.
What gives blood supply to the thyroid gland?
I do not know.
There's an artery called thyroidea. It also comes from the arc in a certain population. So problem then comes when you do those things, then you say there's a branch coming from the arc, but when you did the arc, you say there's only subclavian, carotid, and brachiocephalic. But it's not only 3. There are other smaller branches coming from the arc going directly to organs. Right? But the 3 main ones, there is a brachiocephalic trunk. Right?
Yes.
When you call an artery a trunk, it means it's going to divide somewhere.
Yes.
Because a trunk, it's a large thing that has to be divided. So brachiocephalic trunk is the one that will give you right subclavian and right common carotid.
Yes.
Then the middle one on the arc is which one? So the brachiocephalic trunk is on the right side. Then in the middle, there is left common carotid.
Yes.
Right. Use the common sense that the common carotids have to go to the head and neck, which is central. Then more on the left, there is left subclavian, which is going to the upper limbs and part of the thorax. So it has to be more on the outside.
The left subclavian.
Left subclavian, yes.
It goes to the upper limbs and
thorax. We'll describe it when we do blood supply of the upper body. Isn't you said you want lower body first? Okay. Then from the arc, we can forget those ones because they're going to the upper body. From the arc, we get a descending aorta. Right. Others prefer to call it thoracic aorta whilst it's in the thorax. Then when you get to the abdomen, we call it abdominal aorta. Right. Did you do thorax structures? You did. Great. So if you look at the thorax, there are intercostal spaces between the ribs. And you divide your intercostal spaces into anterior and posterior. It's one space, but we're just dividing it into an anterior part and a posterior part. So the anterior intercostal spaces, forget I'm saying this because I'll mention it again. The blood supply is from internal thoracic. There's an artery called internal thoracic artery, which gives you blood supply for the anterior intercostal spaces. The upper 6 only.
Okay.
So when you get to the 6th intercostal space, it will divide into 2. I would describe that when we go to the subclavians because it's a branch of the subclavian. But the posterior intercostal spaces, we say upper 2 versus lower 9. How many intercostal spaces do we have?
We have 12 ribs, so 1, 2, 3, 4, 5, 6, 7, 8, 9. No, but you said 2 against 9, meaning we have 11.
We have 11. Right.
Okay.
So for the anterior, we divide into saying upper 6 and lower 5 for the blood supply. For the posterior, we say upper 2 and lower 9. The upper 2, the branch will be from the subclavian again, so we can skip for now. The lower 9 posterior intercostal spaces, they get their blood from this thoracic aorta, which we are also calling the descending aorta. You can see these branches here. These ones.
Yes, yes.
Right. So it's for the lower 9 posterior intercostal spaces.
I'm sorry. You said for the anterior part, it's 6 against 5. 5. And then we said from the internal thoracic artery.
That's upper 6.
Yes. What about the lower?
The lower 5, so internal thoracic would divide into 2 arteries. One is called superior epigastric. Then the other one is called musculophrenic. Epigastric has something to do with the abdomen, so it has nothing to do with the thorax. Gastric means stomach. So we'll see it when we go to the abdomen. Musculo means muscle. Phrenic means diaphragm. And diaphragm is thorax. So the musculophrenic artery is the one that gives blood supply to the lower 5 anterior intercostal spaces.
The musculophrenic?
It will give blood supply to the lower 5.
No, isn't. The full name, it's musculophrenic
artery.
It's just, okay.
Yeah.
It's rising from
internal thoracic. Don't worry, I'll show you a diagram of internal thoracic when we start doing the upper body.
Okay.
Right. Then you know what's in the thorax, right?
Yes.
You find esophagus somewhere. So it will give you esophageal branches, this aorta. You find the lungs somewhere.
Yes.
So you also get bronchial branches. Is the lung highly vascularized?
Yes.
So it's one of the organs that have what we call dual blood supply. You've done pathology?
No.
When you do pathology, when you have ischemic problems, there are organs that undergo ischemia, then they turn white. Then there are those that will go red. The red ones have a dual blood supply. For example, the liver, the brain, whatever. But for the lung is, remember I said it's getting blood from the heart via the pulmonary circulation. Then it also gets blood from the aorta via the bronchial circulation. So there's a right bronchial artery, then there is a left bronchial artery. Do they all come from the aorta?
Sorry?
The bronchial arteries, do they all come from the aorta? Or there is...
Yes.
Which lung is larger?
It's the wait. There is one with the 3 lobes. Is a hint. Is it the bigger one?
Yeah.
Right side.
So the right side. But if you look at the 2 lungs, one is 2 bronchial arteries, one is 1. So one would assume that the larger one should have 2, but the smaller one is 2. The smaller one.
Okay, so right side of lungs has 3 lobes. It's the larger one, but it has 1 branch.
1 bronchial artery that would then branch. Then the left one is the most vertical, and it has 2 bronchial arteries. But for the left, they come directly from the aorta.
Yes.
Then from the right, they can either come from the aorta or